Yo, Yamamu, Aqua Baba Echo Radio. So I health and wellness from Masubusu Mutie. I do Sunday say just say the whole world, baby Abefabiano. A health and wellness and Kwan, the only show a bit to me, in terms of health, the baby, I rest my baby Abekobia and Unquan will be a Kamwasem. I do Sundays. I am from Chicago 10 to 12 p.m. And Unquan can once more. Of course, we are I go Pramazo for no yeah, my cousin on the crew, but the same no dear health of once some near Becca. Yet to make health of once more Brian and Uncle Pons to say, oh boy, who buying baby a cosso. Tiboni be last week in also so fan chairman here. Dr. Forest is also to move born come up to Dr. Forest also I did not see baby. Of course, Dr. Atonso so I say no any cancer series, you know. I'm saying I see baby. And the go jenka to aba, you buy no one just and no, you can want some breast cancer. Breast cancer. Last week, you know, you can prostate. And then no, you the breast and so to us, so not just say you kwan kakanka kana cancer series, you know, you was one.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Penny Kanya or more. Say, and you'll be bribby, any ubi, no more be bribby, anywhere why you need. Abusia, a bread to say, so be bedroom up wall. I'm out a crown far. Now only a communicable pa. Well, remit. Any Nidia a year to a fat sick assembly. Only more bebre say, modern with Juma Ding. Any modern dear I will say over my if you phone so a whom I have won. And in tea, well, remit Eddie and she said, Pa, Egua Quamu, so will be to me Eddie Sika Amani if you for our other for a console, computer, smartphone, and answer app, or how beara anything. Say we are a new customer, and answer any dear Eddie kind quadia at have you what then, and it's over to me Amani Sika, free bone to our Untia, a washe, Emma, well, remit. San and Prince of 3 times, Umpewe now open, Jane, and just some, and it's over to me Amani Sika. Akusi MTN and as a Ghana network Biara Swa, how Biara anything. Where remit? We are summon Shampa.
Yo, yes, I am a more aquaba bio, so them can about radio. So, Safena, I'll do a feeding at to her, your life for Facebook, your life for YouTube, your life for MyUncleRadio.com. Your website and say your life for Sassing your life for teen. But be a social media platform be a follow piano. Oko no more. Uncle Radio, yo. And then I said, I'm any Dr. Cletus Baidoo, and I ever treating como afa breast cancer and once I'm saying, I can last week, you can be before a prostate, and to doctor be okay through not just say, the Nedian so aso. And my man, Doctor Akwaba, Doctor Baidoo, not saying.
Nyame adom na onso
Nyame adom boko. Me say was here about time na wajo say pink or say purple. Me man yam say color blind. Intimidate and me fair no so I excuse. Inti me nyaja me nim color. Pink or say purple. I just say bi what does it? Inti ya be yango pause so audience was back. Last week moka breast I posted once and me here. And and then answer the cancer, breast cancer, and once more. What more walk you through kakra, say cancer, no cry, city, kakra briefly. Now I touch on prostate kakra. Now for the real near the breast cancer, no, at us, so say, yeah, one as I think I will join series here, baby kakra frame.
You, my share my screen.
Okay.
So you can show me screen now.
Yeah, sure.
Yeah. So we should what's that say we should know on me.
Yeah, also.
You and then on say a tie for edi kan mi chia mu nyina me
I think for you also.
Yeah. Any affair for say yes stream unti no.
Yeah,
I hope so be a ho ye. Last week no ye can be about you started with say cancer cry any day. Say what is cancer? Now the other started is say so the way Yankopon si ball ade na nyame abode bia no obo no orderly o hye bibia pepepe enti na twerɛ no kra me eti ase say obo wie no hwɛ bibia no say everything was perfect enti no sa pictures mienu ya mi show yi a form die no e show brick wall ya hye bricks no very neat, tidy and organized. Sape na nipadua akwa no netie ye cells no a very organized. Ocean under microscope a very organized. Enti sa hia me hye no. Na say be cancer na bibi boni ba nipadua akwa mo ti say cancer na a creative disorder. Nti wo hwe sa picture ye wo sori a say there is no pattern. If a break we diagonal, we horizontal, if you walk a vertical to say we there is no pattern. Ain't in no picture we I say we are normal, the form DNA normal. A sure DNA you be found say cancer. Now say an artistic rendition so say normal normal a form hand this side maybe me arrow ni pointing me nim say me arrow na
Yeah, you
okay me arrow ni pointing normal say nipa cells say be all the fat all the share your tissues no the share microscope asia very organized. It's a brick wall na a nice brick wall na me show you nti nyame ahye bibia fair and said the see dan is a two foundation or say cells BFN basal cells. And for most cells and basal cells and no is a foundation. But a woman cells ni be bintin na aye cancerous. Na cancerous I would say we the nucleus in the kakraka compared to normal cell. I kakraka and organized. Into na say a destructive. Na say a course of yes, and say grow, na say a nyam breaking through the basement na, and I say basal cells na, and no na say a pre-cancer and a pre-invasive, and I say in situ carcinoma. Intino no, and no. Ohwe through the ya, a through the no sa cancerous cells ya, and nucleus ay blue no. Afe die, aye kese pa compared to form die. I can see ina ebi enyini kosoro in a business a break through foundation, you know. It is a cancer cells a break through foundation that's a spread here and you say I invasive. It is no by definition and a cancer. Say a young breaky and spread here na nyini within that local area in the tissue now. And no, a invasive cancer. And known by definition in a pre-invasive. You say ujana obey cancer or obey spread it. And I say obey cancer, but by definition onyanya cancer. Last week in the year can say we statistics we about US and we share America American Kwan. I say more than 1.8 million new cancer cases were diagnosed in 2020. Statistics no a predict the year you be 2021 statistics in see nyama out into winning as a lag behind because they have to collect the data no into the American and be mostly 2020 maybe do a make 2017 as but so the year 2020 now or say in America more than 1.8 million people will be diagnosed with cancer. Now, 1.8 million people were diagnosed with cancer in 2020. It moved 606,520 in the Mbewu because of that cancer. It is 606,520 people an idea. And last week, they said, Fancy Kumasi Sports Stadium, a funny paper say approximately 30,000. Be a transit comfortably, emphasize 30,000. No, first 30,000. One born a mark 1, 2, 3, 4, 5, sabe 20 times, and then I'll be near base 606,000. It is 606,000. I'll with cancer in 20 or move with cancer in 2020. No, a move say 1,660. I mean, what I'm trying to say is say, 606,000. Who break me down a 1,660 in a woo every day. In another in a woo year every day because of cancer. In America Hanomon, Yadia Kunipana #1 my yadi. We have my yadi free one and cancer in a tosumino. Last week, share a mema cancer and a cancer could mema pa no cancer ye mema pa #1 a prostate cancer any a can one and then no ye beka cancer ye a ma pa #1 a breast cancer a mema prostate cancer na year or #1 uyi no free one man na ba long and that's a yahra one be a home fan. Any Broncos, no, and only #2, and only a mema pa, so #2. So how long, no, any another one, and no one so a mass #2. And a cancer ye mema, a toss #3 for mema and a yen suno kesi and no colon and rectum. And no one so a toss #3 for ma. But so who shed ye kumni papa dear. #2 no. The ye mema a tosu #2. Ye maso #2 no. Ono or jumpo #1 no for mema. No asa jumpo #1 for ma. It de kum ni papa estimated deaths no. Lung cancer #1. E kum ni pa more. Even though prostate is more common no. Lung cancer no unya bia friends say like men can say lung cancer the kumnipa more both a man and men manina. Na #2 no na be prostate for men man #2 no na be breast for a man. And last week you can say prostate cancer no a man mani prostate. I take it back. A mani prostate. A mani prostate until a man enya prostate cancer, mema yadie because at the end no event saying unibia you can't have the disease no tissue no a man no munibi into me uncle Basse or buying a prostate cancer. And normally, the American normally. Because in life, there's always aberrations and as exceptions. In now, Osha fence breast cancer, men were a new form, a man also were new form, but a man new form the tissue, no. A man a breast tissue a much more significant compared to a man. In breast cancer, and say, because breast cancer, a predominantly a Maya DNA. It doesn't mean say beman to mean breast cancer because members also know yes so ye wo enufo unlike prostate na a man no muni bi no. Now say me to also with breast cancer Mr. Kwame say do we be na say a question bi wo man na say bi upe say me explain bi na was stop me why.
Anyhow, yeah, no one tell me why.
In that figure here, me shows from 2017 figure and US animal, and it basically summarizes the medical kinds and say, and all types of cancer for both a man a man who can in a boomer. They're more frequent. They're more a man breast cancer. And for men, man, and say number one, a prostate, a man, number one, a breast, but breast, no, it happen more than prostate. No. It is all ranking cancers, a breast cancer, and then number one in terms of frequency, not number, and I say incidence, not number two, I prostate, number three, I lung and bronchus, number four, I no colon and rectum. Yeah,
Doctor. Now, I didn't know cancer. Now say, lung cancer. No, in the community package, and I just know okay.
Aye.
But who show diagram means so no. Who show breast cancer pana common. Now I didn't know it is a.
No, unse cancer be an in suban. The fact say be a obienya cancer being doesn't mean say that particular cancer a become fast.
Okay.
Cancer be one many common, but when you be a straight death. For instance, say your type of brain cancer be and last week we mentioned it briefly. A friend glioblastoma multiforme GBM.
Of what I say. Who cried the didn't cry just said Chiwana.
Yeah, GBM no say no and your common brain cancer, brain cancers and common, but then you
okay.
Yeah, you need a secure into GBM.
Yeah, Doctor, I believe say as a internet, I for the ponka cry. Me intimate na so ye. I'm say going in and out.
Oh, sir.
But she said, I think say okay. Yeah, so that was so.
And I make us say last week make brain cancer GBM say make us say no dey kum John McCain and no dey kum if I say Edward Kennedy and no dey kum Joe Biden ne ba pain Bo Biden ne kum no and no nti cancer be any nisu breast cancer and more common same cancer be but what they compare lung ni more aggressive.
Okay.
Sana I was say fancy yeditiasi.
Okay.
Into a picture we know share I say a so far die kum nipa na pa na can say kum nipa dia the chomp Ghana because the chompia no ono the or a lung and bronchus and the kum nipa pa na a ma die na to so into a ma die no na mema die so atoso. Yeah, into so our image we no it show the trends of cancer deaths. Into social line we now would say line winning represented a mark cancer no 9 blue, dark blue line represented long and broncos. Into long and broncos, no 1965 mu ho no. A statistic shoot up to say fancy 19 mid or late 90s no more. In after they stabilize kakra slowly and as a aba from kakra. The entire a long they can want some but bibi one my this which na say obi at no ase. The entire 1965 one no a statistic shoot say. So 1960s more in America that was a year pia such a social upheaval. Any a man so 30 years so a member equal rights we should for so crampona civil rights in those that decade it was there was so much social upheaval. Now a man yes almost more fighting for equality which is right, which we all support omo adopt to mema suban boni bia na mema omo ka so mu yesua tra nti no mema suban boni se de cigarette no e ma start so mo num cigarette pa nti man the numbers in shoot up sa and also no those times na cigarette industry no my so powerful nti no ma convince am for say actually no num joten konso cancer bia. But awareness about say jot so cancer and education can plus increase screening and a man numbers and start to say from slowly. Internally for long no. But do share breast my second red. Breast in terms of like nipa breast ekumom stable for so many years. Till even say around 1990s, I fancy numbers as down in terms of as a result. It's a better one, but in some reason, mainly due to education, screening, say a yearly mammogram, a madu certain age, almost 30 years, a catch nipa bebrinana, and son even say 2 more start here. Ne ya detecting in term ni tu asie nti yen chen manen be a cancer ni tu asie na this picture I'm showing a picture of oba enufu the way I hope on share no me I say enufu aye peel skin no off on it is a kawu peel a skin off na wo hwe deeper ne nipple ni and ducts you find lactiferous ducts like and then milk FM1 obanon say so wawo foforo na ne body ni produce milk a produce milk na this part lobule and a lobe Intino a produce milk na a fat duct when musa na the band nipple until baby no a latch on or sakia ne say milk and a flow from all these lobules no so on so we need na lobules no they are made of cells and I said they are further organized into BBBFN say ductules and breast ducts and then the chain and a measure picture be a woman more no further into obanu fu no so breaking it down pass a dear pan a new fu a breast ducts are organized into a group who are a bibri kakra na a lobule na ducts no I said droben as a tube be a connected first lactiferous duct and I say tube be a connected ductules no to the nipple na ductules ne lactiferous duct ni na is embedded in fat into obanu fu ankasa no say wo fa sekan na say wo dissect na mostly the ohunu na esrade And like most tissues in the body, lymphatic drainage. Lymphatic drainage now is say waste products FM. To say the nipa you see down plumbing system plumbing in your the didn't see over fee. Now where you soon the draining in a dirty water no. And no fancy ne ako sewage in nipa and lymphatic vessels. They make any here. Now, lymphatic vessels, they drew certain point be on ma na a form a BB round be a fan lymph node. A boo on magana or how say a joa achime, and only the lymph I swollen. Now, lymph node play an important critical function. Say, nse nyankopon nadwene na nyini pa adwene ntino a very deep and complex. I brought here so. I say, even say in Sufia and I say a drainage in Quebec a draining from the breast, rather than say a bit caught directly into like me find layman's term as sewage, lymphatic lymph nodes basically immune system a biwo examine drainage now say ya dey bi woman na ya dey bi woman na try say be fight no na say na lymphatic like a system the rest of the lymphatic system it in lymph nodes are very very important. Before some me say me can we etiefu na mo hwe no atom stream say so being breast cancer na see you say ade no ya prove say invasive breast cancer. The first thing I hear say e person you say aspreading na the man dey show say aspreading number 1 say you say e drew lymph nodes because e drew lymph nodes man say e call the rest of the body because unlike sewage system in a way can be a sewage system so it is say abruchan mun say bia abrucha de it is say ubu nsuo fresh na wujare ewia na waste water na e drainia ekokobo a city drainage system no more treaty waste na fe the only waste na saka ko bo the source of pipe water no inti sana ni peduan susuti inti sana lymphatic vessels no a cleaning waste no and I say waste no my back to the blood vessels no inti a cycle and inti the cancer be spread through lymph node no a etumi kosa na say that afide na be pie moja mu na from moja ne de it can go almost anywhere. And don't you say examine will be invasive cancer share lymph node to find out adenine aspreadian and there's a special type of lymph node be a sentinel lymph node and only the first point say cancer and aspreadi decay lymph nodes decay drew sentinel lymph nodes it should never come once. Yeah, into the breast cancer in US now. We need a summary of the statistics I medical mind say in 2020 the year I feel about 276,480 new cases of invasive breast cancer in the diagnosed in America in the whole world. The whole world they just be break up. But in America you probably say 276,000 and over in a diagnosis with breast cancer. Now, any man can breast cancer. 99% of breast cancer is man, but 1% is mema. In the mema, any breast cancer in 2020, no more base 2,620. Now, fencing invasive cancer no. In 2020, your diagnosis based 48,530 cases of onomanya pre-invasive kese ujana be invasive cancer but as a yehun in term into bit mas fan so ntem into no number near best 48,000 and a breast cancer of 2020 nipa 276,000 in 2020 a move best 42,000 in a year of breast cancer. In this 42,000 we breaking it down na just a dodo na 99% emma 520. Now so breast cancer trend now say from 2007 to 2016 invasive female breast cancer rates increased slightly by 0.3%. And as all Shresenia is see cum ni pasosua. Maybe once again.
Yeah, Doctor Numusu. Now Numusu no. Opa yan konkoje and ura twaso.
Okay.
This message flow into the twaso.
Yeah. So a mortality trends and I say a senior a cum nipa cancer breast cancer ni cum nipa. Or say female breast cancer death no a peaky and I say a corner highest at 33.2 deaths per 100,000 in 1989. Their pattern in and say 1989 in a breast cancer a cum nipa do pass since I started say ye record and ye keep statistics. And then since 1989 to 2017 a decline from 40% to 19.8%. It say in 1989 na omunya breast cancer na move 40%. So 40% is close to 50%. Until they may find say nipa be say okay, the member say nipa be say 10 in a mark 10 in 1989 and earlier no in the breast cancer a move 4 a be breast cancer until any 1989. But say no and say a mark 10 in breast cancer in 2017 and I say would extrapolate back 2021 a mark 10 in a breast cancer rather than say move 4 in a bewu they say move 2 in a bewu it didn't say almost say you have like the number of deaths from breast cancer. Now the reason nipa enkum nipa dodo compared to before 89 and say you screening a lot. Say mammogram no you screening a man. Number 2 say nipa bebre are aware education of breast cancer and then the symptoms and nipa bebre na nkasa no omo pay attention to omo body no e ma bebre na esa until I say BBS at in the body more non kasa to me epic say I think we men kan say me feel first me feel menufu a yin kan say na BBB as a joa bi ana say BBB not jobi she hanom Sadi any my man Franco who me doctor, no catch him doctor now on looking into it. Until there's an increased awareness. Until no esana and now for Barney pay attention and no draw the doctor social attention into say anything be a statistic a developer cancer be a statistic developer only one in term until you pre-invasive time net yakutua see and then let's say for the most part no. And also another reason to say treatment of course in dear also enura ye treating I better where ye treating I better even surgery cry ye no cry na I better intini na so boa na ama enkum nipa dodo since what to compare 1989 on ma. So what can we mean about improvement across offense US and America Hanuma, HSA, and now some improvement in no. Nipa 375,900. Wasn't no every year be no move. Yeah, into a significant improvement. Yeah. And you know, say from 2013 to 2017, death rates, that's a different death rate and decreased by 1.3% per year. Okay. Also with a mortality trends, you know, say medical can say breast cancer, and then the second most common cause of cancer deaths in the US. 24 any breast cancer about the same as abrofoma. But say 22 ni banya breast cancer, the chances say breast cancer no ebeku no higher than abrofoma. Me say repeat biom. To doom for and as a black women, omunya breast cancer about the same rate they say white women. But black women die from breast cancer at a higher rate than white women.
What repeat? Now, I'm add internet, sir.
You better a training offense in the presentation. Okay. It's high. But what am I a brief answer? No, because I think it's a pertinent and a relevant question. The reason in a multifactorial, say if I say multiple reasons, but number one, the disparity in healthcare system in America. So what America no one dream say when obroni like about healthcare you be sure tuntum ni when broni about healthcare accommodation you show the same rate or that and you the same because they also say nurses, doctors, more hospital no, or they are part of the society. No, racist and biased tendencies na no. Before so be doctor, before so be nurses, wonimu still. Ebi one man yes buapayo. Entina events if you be say on can say unconscious bias. Not doing that any so or bias, but I any su. Intina offense ebianka obabia ba or say oh doctor me hu bibi e wo menufu inti me pese ye kwhwa de kro oba no complaining no me say black woman be the cancer brony the next day brony woman be so about no say doctor the same exact statement say me hu bibi wo menufu I think say we say you investigate. More likely say doctor Nebeka share brony ban say oh when will be you and from the yanko MRI and I say yanko mammogram. More likely so catch brony ban sir than so catch a bibini ban because say oh dear for like pay attention into Kofi next month and then next 3 months so abane ahe in so many cancer I just say like we say tutuni ban on Indian no like a bit
invasive yeah
the biases medicine another issue so na say insurance for say a society is such say minorities, they tend to be like poor, less educated, and like less wealthy. Into the go on no need minority, no need insurance. But also majority na brofuna no the opposite is true. Into no or no say Bruni ban say no a likely more likely say on or insurance. Medicine so no you say the nkwanchan ade fe discan eyo test aye ni expensive or intinu no say wo insurance and you say omunum say ye your test na at least someone's going to pay for it intini na na part no California and those woman bia no Hispanic woman unya who say bibia beda ne nufu mu na oni insurance intino no wankwanko amianko cheki na we na okoye no a hairdresser we na okoye juma na me colleague ba ku bi okoye so onkoye niti intino okoye niti oba o me colleague ba intino oye niti na aso nkomodie mu na oni so oba ne doctor na okan say me feel bibi wo manufu mu no na bra o me insurance intino ade no feel be say bia say 6 months ni also no there bra what the bra county hospital you better check your own insurance when I just come now onim says own insurance at county hospital and they will still take care of you into a buy and that time now a tumor and started to na the question na be say golf ball kakaka na as spread edru ne nufu mu and edru amami as spread edru na motu lymph nodes no mu edru lymph nodes no na maybe a bit me as spread it further than it is anyone's guess. It might spread it baby break. And some risk factor say a day and na increase obi chances say obinya breast cancer. There are risk factors, which we're breaking it down into two. Say modifiable risk factors. Modifiable just say which my who be. And a non-modifiable risk factors mean who be. Non-modifiable risk factors in a medical can once. You won't mean who be. Breast cancer a to no. Bibi enu may absolute say me ka say bia ma o manyina no just say younger person because me who oba when you 18 years when you breast cancer. But anyway dodo na no ma o manyini into oba bia no wunyini a na o chances of getting breast cancer no cost through usually from age 50 years and old and more. And our chances say we have breast cancer and air cost. Unipa undoing she and for aging into a non-modifiable risk factor. Undoing found. While soon no undoing your found say your woo or ban. Your woo or ban who 99% chance of your breast cancer compared to be your own Bema. Only just 1%. It was soon no and so a non-modifiable risk factors. Yewo genetic mutations be and also an increase obese risk so in your breast cancer. The most common mediator maternal always a friend BRCA and it didn't say BRCA1 but yeah can't say the easy you can't say BRCA1 and a BRCA2. Some mutations so will be a increasing the risk so your breast cancer. BRCA1 so be was a mutation be on and yet just breast cancer and one or increased risk of getting or in addition to breast cancer or a higher risk for ovarian ovaries nicosiano or no cancer to me a obio BRCA1 or higher risk of nicosiano cancer baby and I said the pancreas so cancer baby and I said the uterine cervix no, like na wodie no cervix no cancer baby. And now say endometrial into uterine corpus. And also no or breast. And now say ne so no. And now or it's BRCA1 for no omunya breast cancer na na omu higher rate so benya triple negative. There's a chain make one say triple ye diagnose obi say onya breast cancer ye test person who cancer ni suban. Oh, that the most popular test in ye share in hormone receptors into estrogen, progesterone, any back could be different hair too new. Until some and some way, or more BRCA1 and some mutation, and Nimi and Sunny now tested negative. Yes, only be only estrogen, the cancer, any estrogen receptors, any progesterone receptors, any HER2 receptors. Now, cancer is very aggressive and difficult to treat. Now, Ghana in particular, well known in medicine, say your high rate of triple negative breast cancer. The other mutation in BRCA2 and also increase risk for breast cancer, ovary, pancreas, and gallbladder. I can say bonyono, and also increasing the chance of cancer be woman. And a bile duct, bonyono, a fat drobem, a bile duct, and also increasing the risk of being cancer womb. And also say skin cancer, I find melanoma. The BRCA2 so the air now Bema be on ma and now maybe see of feminine no was some mutation maybe into Bema on mutation also or an increased risk for breast cancer in addition to breast cancer or an increased risk for testicular cancer.
Doctor Antosebe cry shooting straight.
Well, yeah. And a prostate, the account was last week, and also an increased rate, and also pancreatic cancer. But the good thing is that most breast cancers, no breast cancers, and due to one and a genetic mutation, BRCA1 and BRCA2. Oh. I think say the numbers may kind of, but it should be about less than 5%.
Okay.
Yeah. And another risk factor so to me enya ho hwe no say oba time burnout or period estate for the first time in your life. And also to me enya ho hwe. And it's a time or period na a child who call menopause. And for the most part, I know some medications were on there, but for the most naturally, and you know, control or internal. And when we non-modifiable risk factors, or bar on the period started before age 12, the chance, the risk is higher. And the reason is say, or bar just say the principle on reproductive history say the longer the first O'Bannon was exposed to like sex hormones, the higher the risk of getting breast cancer. Sex hormones near estrogen, progestin. No. Non-modifiable risk factors a being say having a dense breast or baby one man naturally a more drew. Obiso on ma nenufu no like a softer peche. Or ban nenufu dense or risk higher risk so be develop breast cancer. And part of the reason here say or no crown screening with mammogram now a very a more challenging to pick up like breast cancer say it develop because a dense. It is said the mammogram no emphasis I say car, the car light o drive ebi ahomache na o drive yeah wo so light na ma hu achiri ma hu de ekoso wo fence abonten wo nyina ba se ekoba se ukofa ba bi na se ebo esi very air fog very thick fog utro light na unhye dan hu achiri bia sa na dense breast na aye imaging no many fence more challenging until the non-so another non-modifiable risk factor. Personal history of breast cancer or certain non-cancerous breast diseases. Obi on man odi ke nya bi dada. Nti so when ya bi dada pain, when ya breast cancer pain, in na ye koyo surgery na ye treat you o chance o sabe nya biom ne automatically na higher. Nti no so ye risk factor. And also so obi on man o nya breast cancer, but no nya certain breast diseases be if I say a typical ductal hyperplasia and a form of cancer, a increasing risk for getting breast cancer. There are other benign entities as well, and that's even DCIS, ductal carcinoma in situ, and your cancer per se, but ujana be invasive into be cancer. And in those things, so we will be so and the risk of getting breast cancer no so higher, non-modifiable. You say any BB about my say me ye BB na master pono per se. Family history. Busunya bi won ma na breast cancer ewo and also ovarian cancer medical can say there's a genetic mutation be a friend BRCA until no say ebusian breast cancer ovarian cancer woman they say be na mo chances some was BRCA mutation here higher until no so oba office ebusian no also oma nani kun nenu fu ho also oma no doctor ya aware no mo pay attention na omo hwe ni yi obi so wo ho no ma na bibi ntinu no onya bibi in the course of the in the life they say biana lymphoma konya lymphoma bi lymphoma so I say moja and as a lymph node the cancer onya lymphoma bi e biana ayekese a na e compress a vital tissue enontinu no omkoye no radiation say e kum tumor cells until we exposed to high dose radiation to the chest or exposed to high dose radiation whether say for lymphoma and also for a prior breast cancer or not or a risk of developing breast cancer, especially the most common one I'm developing angiosarcoma and so on. Now risk factors are no bet my young BB.
Yeah, doctor, I am a main stop on the Konumsu Kakrani Yanko do Draka Kramra. So, yes, stop over there. I risk factor with my young BB. No, the banner I pick you up from there. So, the bay, I bet my mouse so time Kakana was with me. I catch some breath because and then so what Wakasapa and see. You drink at Wabana, ya refresh your Kakra.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid health insurance program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, yes, I'm Kwababio about Go Radio. So, as I found out what video to her, I am Dr. Cletus Baidoo, and I had to think more breast cancer once. Now, what church in baby, what my statistics, so they sit here, and one when be a bit me a coon, and in our church, and when I said the address were, it was so breast cancer, risk factors now. With my who be no. I don't know, is in your drew on more or church or church to us. And to Dr. to us my
You Kwame Midasi, Dr. Alforis Michiao. Yeah. Into yet once
producer one.
Yeah, yet was risk factors about my own baby. The kind of make one seminal weight. Especially after age 18. Or can see too much, you increase your risk for breast cancer and other cancers. Can be one like way back in the past. Like endometrial cancer, say about where can see PR risk for getting it in her. And make endometrial cancer briefly cry once more. And can so who say being a like Emma say pathologist for say ye share will be biopsy under microscope. Now say you who say endometrial biopsy, you who say cancer. What dream crowd because or your mommy penny would at least 40 or 50 years and above. But say I don't mean emphasize and operate. It didn't say say I don't say Osha will be cancer. Now who say will be endometrial biopsy. Now who say cancer. Now question the age. Now we're younger. The next thing I say measure say ni BMI is saying. Uncle Henry no kakaka and BMI over the chart. Until modifiable risk factor weight gain after age 18. When no bet my own baby, where DGA exercise with my own baby. Being overweight or obese after menopause. That weight, weight, what I say after age 18 and I say after menopause. The reason fat increases the risk of breast cancer and endometrial and other cancers. But me focus on breast and say the reason is say people fat and cancer is fat strategy. No. Omo ankasa no to produce estrogen. Into the more you have, there's a who expose your body to a higher levels of estrogen. And it's the reason I remember saying no crown say bema or soon obon say na nenufu crown na say ebobo because the body is exposed to like higher levels of estrogen.
Man go I'm no for grounds to change my idea.
Yeah. And the other thing is to say, fat natural body produce more estrogen. Obiso na and now so go to.
I've just said Dr. Forbes observe.
Not per se. Would clarify the mommy about we say your conditions be also so mima obi enough for gynecomastia like
gynecomastia.
So I know just say nipa no. I mean, does that also increase the person's risk of breast cancer?
No, gynecomastia increase nipa na risk so obinya breast cancer, and gynecomastia no mostly a mema in enya. Because yeah, any mema no your breast unse yes certain maybe say me go back, but me show picture be say the oba any fu pale skin na see
It's yeah.
A mema de no ye nufu no obema like when you kra no nufu no ni stage e won it is say oba onyan go through fencing menses a very mature like in developers into no more when you gynecomastia and say no the way I diagnosing say those fencing immature ducts and say adults and yes, but it doesn't increase your chance say ubenya breast cancer. Yeah, it doesn't. But the point that I make come back is say estrogen no say a dose wo body no mu a na ko ye be ma na say nam kese ni ntin after your body no kra no say your member your figure your natural figure my body no after the na assume to say the oba susu figure akesefo no and it's because of estrogen until no point for men and there and no point na me reason to be on my be ma be on man e man enu for abobo both na bo hwe ogina ho no na hwe na chi a I say like when said anya say bia be ma ogina na nan so structure is because of fat na wo no na estrogen na e produce. Yeah, and the next point no say make I say fat in the end and naturally wild body they produce, but obabisu one man will through menopause. Now menopausal symptoms now fencing will go through is so tough for her. Until yes, and to me is okay, so then you be hormone therapy. Or common menopause is because the ovaries na a man produce estrogen no kesiye pa na ovaries na fed when you it's not producing as much estrogen as before na yes ana no munya sa hot flashes ne sa menopausal symptoms go through obi one man dey very severe very tough for them. And yes, and I'm say okay, and it's idea yes, I'm found to hormones, hormonal therapy, say the bear or symptoms the bear better. But we yes, and so increasing the risk, say between breast cancer. Into that point in alcohol is a risk factor for breast cancer.
So that be a kasa, weight gain, alcohol, tobacco, no, it goes across board. They become once more risk factors, weight gain, alcohol, tobacco, na sadly way, I don't know. Of course, I have a baby, not salad, especially alcohol and tobacco.
A habit. Once I didn't say, be you sue and Ujaya Eddie, and then I said, bet me cry don't even try it. But say, what you can't try and I say, a worrying son, I owe a tobacco, no George, I owe that. And now, and Susan Swa, a Benyama body, and it's a one, and Faswa a need for body in educational Kwame Menu and Dr. Fori program, we want the every day into China so na fajai a sadie no because obesity I can once and can see any alcohol. Last week, Dr. Fori Kaya, you can once them say prostate cancer so no obi or rain in san obia onya obia why can see omunya prostate cancer omu de aggressive. It should all this, it should be a motivation. Say, idea maybe a sense. Idea me minipedria nankasa no a toxin in a medigu minipedrium. And apart from say essay Unipedia and increase your chance to be in term of cancer. Into I didn't know also now some be a number power say the mamma to the mammy, but or see the mammy can say, oh, what you baby or on one casaba before I call. I didn't know so to tune the cushion and until the name of you on man say bit me jaya, and yes, a bit me jaya, yen more didn't see a bit jay because wine na dear them. Na ebi wonu ma se bi a wako party obi enum de no nti wako na senka wako party bi na se obi yasa cyanide poison bi esi wonu se obi enum di ubanum o se utriti na say last week me kan say o se you treat your body say luxurious car say they be obi nyeska koto Mercedes Benz krana or an papa no cohun no polish no yes your body a year be 1 billion times more precious and we can say complex same Mercedes Benz via we are say it is so we share Mercedes Benz oil change now we on time go compare crown so crown say me can dey me fe ni agro san also say san your car body need there also you need be at times 100 and I say times 1,000 crowd. Physical inactivity, it goes back to weight, couch potato, or bar. A man in a soon exercise, organ and the very rare, so won't say, I mean, we become a gym a very rare, so won't say gun and need by pie exercise, but it's a gun crown and assassin. It is all your brochure no more. Now say if I say be our call Ghana China, they also say Ghana for no Ghana classes. I say Ghanaians they become very conscious of like some of these health things. And maybe your motivation may be different. So say or exercise now we look sexy in India, but I mean in the long run, a boy want health also. Modifiable risk factors in the air twice on a B say oh no wait and I'm say
watch it.
My children women shouldn't have been here menstrual long menstrual history and modifiable but modifiable no say not having children to a large extent in a modifiable not having children or having first pregnancy after age 30. The longer you are exposed to all these hormones, the higher your risk. So, by fencing, any saying, the body change, the chemistry, the hormones change. Into onyan cycle boom, or war for a number of months, onyan cycle boom. That kind of rest, a boa body, in terms of like say it decreases the risk for getting breast cancer now. And a high natural levels of sex hormones and recent use of hormonal contraceptives. We don't know it is from a part of a bionoma like high natural levels a natural I can say
non-modifiable.
Until but so if I say use of hormonal contraceptives need modifiable because a exogenous. Yeah, but the next important point in an ASA say oba wow now so ma banana breast milk man and fusu because so say onufuni so no. And no, you are increasing your risk of breast cancer. Or say breastfeeding for at least 1 year decreases risk.
Yeah. But so and this will be a breast milk no and on farmer maybe as almost man used to breast pump no. Now I tell for no the amount I don't know the same as not breastfeeding.
And no so the pump here a breastfeeding because and akola no baby no magic being a woman now the katare so na baby.
Yeah, but because the time is a question son and I be a big jinse bia akra no amfona no anum no for na no and it just one feeding no.
There be. So what the pump here, you are breastfeeding.
Okay.
But obi on ma on pump because oba no fence or foforo na ne nufu no hihye na say baby no on so on pump here. Body no yakopon amazing thing or yeah about body say o feedback loop into a body na nkasa no e ka kire enufu no say enufu so ya we producing a too much into giant. You know, oba on feed one go for on man ba enufu no and chebo na enufu so na enso twa but no na fence any good no so yes na no na we increase your risk say we your breast cancer and yes we pump na say ba out there it say the baby alachia on and never having a full-term pregnancy, and it goes back to say long exposure to hormones, no, and we can alcohol so view. And to make better signs and symptoms, and so open some cost one, I say be a question and a contribution be a.
I think so. Wait me to ask.
Yo, and you know, signs and symptoms, no, a differ phobia. Now, if you want to man, for instance, and show any signs or symptoms, especially say early breast cancer, it may not show. And as I say, a type of breast cancer be an invasive lobular carcinoma, and it may not show much signs and symptoms. But warning signs about me a binam may show the picture. So I'll show about way in a I don't know, say a clear screen so.
Yeah, very clear, as a while.
Yeah, I like that tree. A while, don't say I want to be sure. I say, the best year met me, I say, because a joy be a machine in Nufum. And not just say a joy be a breast cancer. Younger folks, like a man, we are very young, teenage years, a joy to me born money from usually around time of young period, and no, most of them by far benign. If it be fibroadenoma, a benign breast condition, it may be at any age, but younger about young who feel be a bibia by the most of them a fibroadenoma, a benign income in your shade. They say you just feel that a lump on say about when you form. And no interest be or be a young, in fact 18 years. Not say or feel a lump you on also or non casan fan and say just follow up, say be a hour follow up with a doctor and our nurse practitioner, necessary physician assistant, and so on. Follow up. Because sometimes we are worried that better say you be any biopsy. You be a pathologist, no because you be also a worry. And no nama was majo rather than say be one number one na be as I deal with could it be cancer? With the cancer say the youngest patient my diagnosing with breast cancer no be 18 years. Me name the family history how is it, but most likely no at that age just say be no BRCA mutations here I can one say earlier and also say very powerful strong history about cohesive man which can be a breast cancer won't be and ovarian cancer won't be but 18 years no be prom ina no feel no be one no from ko catch doctor and the doctor him said that age the most common one benign fibroadenoma into also conabra into no ye no conabra na feel na of feel say ekese finally ye no biopsy na breast cancer na spread akọ the lymph nodes na one amotu. Another sign so obi betime say so sure about we are in for Kwame then the one who
We
Yeah. And what I be with one. Who say a oba not normally or something nipple on a ginaso
But that's a chukum.
Achikum. And not just say obi and a new for achiakum be and breast cancer because be most one man natural in achiakum. But what it mean the picture we mean say what the ne ginaso. In after the wound say I say a chikum and I say achiakum. Go and get it checked out. It's a nipple retraction. It can be a sign of breast cancer. And now, Osha Oba with Nenufu na in the skin and I wahan no. Meaning some more appreciating well in the skin it's thicker than if you ocean the Nenufu Asia crana. Aka cree no. Like skin about this area, it looks thicker than this part, and also can be a sign.
Yeah, and our class so I just color kakra. As a red kakra.
Yeah, I say I look orange. On you even a French word peau d'orange. And no say no but I don't know for the minimum how I will present, but a lighter skin above both the skin area not or on a change color like orange reddish. And I know saying a breast cancer. I mean a sign of breast cancer. And don't say you confirm more crana and a like a higher stage inflammatory breast cancer. But anyway, another thing is what we say. Maybe your skin and baby potty first na okay, but baby potty after the asset or no I mema come to say to be any dimple na phenomenon. Not a one I mema come to skin dimpling. And this is no because what happens instead cancer no says a cancer no was yeah cancer it means skin a tita on the skin na a chin like it's pulling down into na also dimpling. Other signs and symptoms no mention the picture no a bisu say fancy o feel say
Doctor Hassan Abako no so no I don't see in your patients the question be about some kind of one son also what is benign tumor and say is it the same as a cancer and as a must will be concerned when DX with benign tumor. Is that terms not what you say?
When diagnosed with benign tumor. Okay, you can say tumor on West in America was in on my question lay acquire say I base lay for social terms but in medicine it with different meaning. So because I'm saying tumor, who catch a doctor say you see who call hospital in a doctor hospital when you tumor. What shall I much information? Because who can say tumor, and not just say a cancer. So cancer dear. Most cancers no jana a bit nipa na and as a bit must say tissue in that area no into cancer a bibia say body no a bit nipa no bit must spread it and then a cancer tumor no bit menya tumor no your tumor you divide into maybe 3 crampon but broadly need 2 baako say benign ne just say idea no uja na enya ade bekum enya ade be spread e be bit my life a bit discomfort and I say to am cause discomfort but enkum and spread it and if any benign best example for a man fibroid or babiate fibroid pain so ba what dey awodie no fibroid tun betum fibroid no enkum nipa benign. A bit my case pa one on fibroid kaka the same tea. A bit me pushy
Doctor Tidiason.
I'm it so. Yeah, I think I may yes. Yeah, a bit me pushy ebiana I push it down on if I say the bladder on and China Johnson no and I say a push it down just a bit more cause discomfort but and only per se no enkuno and I spread it into a benign fibroid benign and I a we can say cancer and I say a tumor beer and it's a malignant by definition cancer malignant say a bit me kum it must spread it may spread the corner baby a one bit me destroy a tissue near a war. There's a type of cancer BFN basal cell carcinoma. Because a skin cancer is the most common skin cancer. And you say no, and spread this a spread that could bring money other but ujana that be a done no a best say a tissue no wanting say be a be nim na betoa na phone na betoa. That's one kwame enko train through on ma enku no. But the best say, but a cancer because it destroy a tissue, that area. Yeah. And I know a fancy the difference, Meaning
modal. On to bet me out to us other risk factors.
Yeah, until other risk factors, But medical cancer skin discoloration and as a redness and as a orange. Obi on one and the nufu no, and as a nipple no. Almost a skin and I say why I flaky and then go and get it checked out. Obi or no more now when your nipple discharge nipple maybe or the same year so moja cry a womb and I say baby but say breast milk. But so bar will go for us or near the for night say breast milk about and then big deal. But Sabia I fancy or like or bar or true like what child war na umiani nufu so na se bia nufu ano na se bibi ba se breast milk and na se moje ba from the nufu ano na they should go get it checked out. It doesn't necessarily mean say breast cancer because there is another condition be a benign but increase your risk for breast cancer if an intraductal papilloma and a tie if I say issues are symptoms say the oba nufu no bi okumia na moja ba because of BBI one.
Yeah, I hear Mohammed the question there, but say your man sons and son you move on. Was Obusa say no crese so mema anom mama for omo ma ware no per se omo no for na prevent breast cancer so the na o kan no crese
me eno die obu dia men kan ye for me mana no mo poma dia yo
dada
yeah can say a breastfeeding a lower risk of breast cancer na nye me ma yes say breast milk no say be man no mo ba no for no breast milk bi asem bi ani
okay yeah and
Muhammad I don't know and Beyonce last be here can we be a question say so only oba da lower is a name favor me man dey yeah it's another thing so say so about on your buy or so wanufu e duru e bia anasa e bia na pa bia cancer na bojare kira mirror mu na hwe wanufu the more we hwe wanufu no the more na we are conversant with it changes bia ba utumi di wani kosua no kra hu say wanufu it looks funny from what I remember wako na yakohwe say mammogram and mammogram I'm making sure to be biani any change in the size or shape of the breast biani go and get it checked out. Who feel pain when you feel baby and go and get it checked out. Sometimes and you say it may be a benign no quite need tumor crown be a cancer a friend saying would unam na bia would when you feel crack ball baby hard if ouch at that time no but after a few days after don't say that but a woman after the honey just a tissue no one maybe when you different fat necrosis fat no crying and I say until you are feeling some pain be and I say it crying makes you feel lumpy go and get it checked out. It may not be anything but go and get it checked out. And only signs and symptoms are or baby to me who own a new phone. Like I say, if you want ma, if you are fancy signs and symptoms, and untina you become breast cancer screening once and
Yeah, Dr. Ansan no. I think say you Sister White or the question be about no busa say o sleeping position to be a da. Then I'll be out down side and I'll be out me down for so as be a no for kakra ba and no so no kakra ba. I don't know. Once a while, no, I don't know. Just what chance of getting cancer now? I mean, breast cancer now.
Yeah, say kind of signs and symptoms young Casabia, a nufusuo, a bibi, if you nufu to say nufusuo ba, I just say when you breast cancer.
Okay.
The other say, bibi a year unusual, biano no, eba, ko na ye ko check out, but say, who could that when nufuso? Na say chin no be a like nufusuo bi, meaning and the minimum how much there, but nufusuo bi aba yeah. Me, I'll go and get it checked out. But so we have regular mammogram there. Oh, and no, fancy. And I say, be a side and inch be now have your next your yearly mammogram now. Don't panic, because ABN and so your body know different types. If you want a serous fluid, serous fluid in any cancer, any shade. Like a crow too be a drew a crow and Cassandra was in a obi or the sour to swa. Now I soaked in a fencing in Subi.
Yeah.
And you say a serous fluid, and yes, a basically tissue, I break it down, any blood, I break it down, and they produce an issue. It is other one who say pressure and can cause like the mechanics say fat necrosis to say they be a when I'm now do with food, when you pin be so one said that now, yeah, and that's what take care when be a seat belt, no, at the one who super and your cheap break being a press when you now a 1 year, yeah, a bit you might ensure a cry if you nip on more back. And no, any BBI just say when you cancer. But say, the American say you have to know your body, no, what I'm appealing to it's here for ne obi answer or baby and know your body, pay attention. Unusual. The answer they be out there when you for so. Would a fence would one for so and so be ama. If you say young couple ball, they were fusu now than to the one for so. It should be ama. All of a sudden, the past few months, would the one for so on sorry not say Uber brow and I say one more brow and what had and not. And you're normal for you. Until San America say go and get it checked out. Until it depends on circumstances. You say Muda.
Yeah, that emergency Anna is in wine and change a cramana. I'm a time.
Oh, yeah.
A copper. Now, Mohammed, the question be by some question I think say on answer that. I'm on the question how they by the Befriba Memman on Quan or Bisa. And but the question be I think so your mom medications for be a breast cancer dear, but no Bisa say you will supplement be a bit more preventive breast cancer now.
A supplement in the bed is a woody.
Okay.
It's any Debian no a program in Moka.
Balanced diet as somehow.
Balanced diet. Baby. Would balance diet. You make sure say nuts. Any vegetables very rich. Any fruits are very rich in your diet because food pyramid now almost selling my time and was secondary school. I don't know say time agriculture and nutrition show food pyramid this animal. And no the they had inverted it. It was wrong. Yeah, because some of the meat milk is so critical, but the opposite say fruits, vegetables, nuts, and then they're more critical. Now, if I say milk, meat in animal no crying, a who said here that much for Nipediano. But a say a Western world, everything's about money, marketing, and onion and both not a I can't say omo nya nantwi no normal association for normal lobby say oh debi or say a pyramid say win nantwi na ma very very good for your body. Yeah, sell this idea.
And so omo ye na ntwe ba me say say
how they you yeah, breast cancer screening no age 40 to 49 years no oba with the age 40 no the age 40 as at no doctor and now healthcare professional any unkomo 50 to 74 years no na say an average risk of breast cancer any wobusu enum kese unya breast cancer da mammogram we nyina no normal na o doctor any would be chance say okay to see an normal every 2 years in be member and in detail shortly. Breast self-awareness breast cancer screening one of the most important thing in breast self-awareness because all the time you who say a man who pay attention to a body I want to pick breast cancer I mean can say lesion and ujana and breast cancer want to pick immediately na ya call biopsy na ya ko two if you want so it so we a cell breast example jami romu na wo show no for a very very important a screening na wo ye na wo feel we no for no make one say shortly clinical breast exam here clinical just say like waba clinic and I say doctor na a nurse practitioner so breast exam but de no kran no wo de na wo ye no self breast who as a person do ye a more sensitive saying the doctor and nurse practitioner because wo you should know your body more than a fancy doctor no obehu anufu no a mammogram and so a fancy a way this screening in a breast MRI and then there's ultrasound and none of them no but self breast exam no say na oba also ye no bosumi bia once a month oba onya period 2 to 3 days after a period no na why yes breast exam no udi kan ehwe wonufu no first thing just inspection we show wonufu no mirror mu na making sure say everything look fine. What should one more true because breast cancer a bit me start a more true. Obi one ma or as a accessory breast tissue or na more true because of the way our body is developed no a new tissue ne bi wa ne dey one more true and until no otumi the breast cancer no a started and actually a lot of breast cancers no a started close to amotuum no your friend upper outer quadrant a lot of breast cancers started intino no onwa hwe amotuum no u pagya on side to fancy bia utisi a wa hwe amotuum no do wo mirror mu na fe de wa fa fingers the next picture no fingers for ebia udi nkun kakra fa ho na sese wo shower masem na wa wet na fe die udi fili wonufu na udi fili wonufu na your three major ways out in the fili what me feeling up down up so as a zigzag sa or I don't know fancy one way and actually to me it's actually the best way how they do could between the fili wonufu then there's the wedge wedge in there o sate wo nipple na dey akosa na o dey akosi bia fancy with chest in fin na sa fa another or they call rounds into a wedge any circle and they call round but I think said the best in a win because we know as cover more territory be a bit missing with wedge and I say round and round into not a fencing and on a self breast exam and your walk mammogram no because mammogram a type of x-ray a low dose x-ray you share by nufu no into your phone nufu na there are two platform bisu na the machine mammogram machine na compressing kakra na ye cha na fencing breast radiologist no akohwema hwen so hu bibi abnormal bi wo ma but mammogram no or say it can miss breast cancer false negative and it may happen because BB non my perfect. Oh, we are say. And I say it can also appear abnormal, false positive. The entire mammogram say so. So screening for any disease, you want something that is very sensitive. With my applique false positive cry. Now just say no the more sensitive and just say the less say more messy cancer. It mammogram is very sensitive. Now but it may say cancer, especially depending on the type of cancer, may come back. Could be say invasive lobular carcinoma, and you say mammogram with my messy. I say about 12% of women who are screened have an abnormal mammogram. Into your screening so offer a 100, a 12. No. Or mammogram, a better say a fancy a abnormal. But that 12, no. Who could show say, but only 5% of women with an abnormal mammogram have cancer. Into a sad nipa 12, no, who breaking it down. A move 5%. And I will say mammogram no abnormal no cancer. And a false positive say are most likely during a woman's first mammogram, because one thing about mammogram and until a year in say they compare medicine because in fact hunting I hope born near man 2 no you 9 you a into be sometimes in person say be wrong you compare to the other one na mo say ade we wrong in sana mammogram reading it as a man good no or mo dey compare in a moment to me catch anything unusual, but say first mammogram there's nothing to compare with into no or to me every day fencing wrongly, because they be an ade no fi say abnormal. Senka ucha mammogram if I say 5 years the previous 5 years and every year be na ucha kobon say dey na the same size and change here, but we need that frame of reference into no or share now feel say a weird, let's go and get a biopsy na okay no bibia. Cumulative radiation exposure so concern, even though it lose those x-ray because yearly and I be more concerned about exposure, but BBN and a risk benefit. The benefit outweighs cumulative radiation exposure. It means person be a bit too worried. Say, hey, me koya mammogram, and because they are worried about radiation exposure. Radiation is using a low dose X-ray. Into a BBR. Also, you're too worried about. And also for women at average risk of breast cancer, no. The American Cancer Society, recommendation is say 40 to 44 years of age. Between 40 and 44. You have the option to begin annual mammography, but you have to talk to your healthcare provider. Stratifying based on a history. I mean, quite fast. Time
into just say now questions and so it keeps coming in.
Yeah, important.
Yeah, very important. You're changing until my age.
Yeah, 45 to 54 years. And your annual mammogram. 55 years and older. And say by 55 years. Doctor mammogram be normal. Or between one discuss no I say a free neck every 2 years. And I'll say some women at high risk of breast cancer will boost you or back very young. So it be me 40, be me 30, who breast cancer. And no. You to me the breast MRI, the mammogram. Now you started at age 30.
Yeah, some question want to tie into the now can. Obviously, at what age is the last mammogram in a woman's life?
Yeah, okay. When you see point in mankind saying continue mammography as long as overall health is good and life expectancy is 10 or more years, because may diagnose breast cancer no by when you're 98 years.
Okay.
And a breast cancer one of the non-modifiable risk factors in here say wounding. The more wounding, the chances of breast cancer are also. Mammography in India, usually lifelong, unless there's a medical indication be against it.
Okay.
Yeah. No. Nipa makase normal bianco body and effect crack under the microscope. Nipa obi on the breast in normal, or microscope no say it here. First lobules in lobes. In a way, and America say ductules, no, a one cell layer in a basal cells be found myopithelial cells. Into any normal. She obi an idiot no. A nyanya cancer invasive, a pre-cancer. She we are cancer normal.
Yeah.
Yep. That's difference. I say Yehuno and Tem Kakra, DCIS. About Modiakuchasi, and Nasibia, hormonal therapy behind the man. Where invasive, I spread it. There's like no order and number be the way to put up a lymphatic space. They say I spread it to the rest of the body. And when I say, no, it's very hard to diagnose. I want to have ophelia or one mammogram, and soon, but MRI, no, it me pick breast MRI, and in fact, invasive lobular carcinoma. Then come out some case treatment, either conservative breast treatment, surgery, or mastectomy. And fencing use, and it depends on the tumor. Say I didn't as spread day in a patient so then or pay breast conserving surgery. Say ye be lumpectomy. Yen chow funi na be a tumor one ye chaff ye tumor in a few body, and a breast conserving surgery. No mastectomy just ye chow nufuno. And a surgery in lumpectomy. Breast conserving is the same as lumpectomy, mastectomy. And yes, as well, I say who says invasive, I say who say a do lymph nodes and a coamotum. Internet because a lymph node defends sentinel lymph nodes. And then the first point say is spread there, you can call. It's a doctor, like most breast cancer, it's a doctor. Internet and no, not ye chaba, a question of microscope when we say cancer and a tumor. Say drew sentinel lymph node, after the or ban you could yield lymph nodes in a woman and even axillary dissection. I say how many of the lymph nodes in a cancer they drew because based on some information in the best stage, I can just say cancer this aggressive and this level prognosis AAC. Be a cancer based on science AAC. It doesn't mean say 100%, but mostly accurate. And based on an say spread and they say the chemo, say a pre-cancer, a DCIS and say be a hormonal therapy. Say see an abefu, the abano immunotherapy. I'm sure it's in Uganda because it is a enjoy our check. Immunotherapy, it means you see immune system. If you cancer and characteristics, the immune system they are fighting cancer. And a radiation, and so basically last week I said radiation essential and yet the high energy beams in the person they fry tumor. If you want more cancer, no one more so much say you could try a problem. Into not ya kind of radiation, and sana because we radiation is shrinking cancer, and sana surgery. And radiation is recommended for most patients having breast conserving surgery. And on the radiation, frank a crave account just to make sure say a clear BBR. Because it's yen chow no funny and say a coil lumpectomy could 2 tumor non quadia. You say you make sure say you cleaning horn today, fry a high beam not fry horn. And for women with early stage breast cancer without spread to skin, chest wall. It should be chest wall or distant organs. Breast conserving surgery plus radiation therapy results in long-term survival equivalent of mastectomy. Into outcome said you'll be a good 5 and 10 year relative survival rates for women with invasive breast cancer are 91% and 84% respectively. The reason is very high, and I say, and now mammography you're picking a very early stage into the spread into your own son, the surgery, treatment, radiation now. Survivor at 10 years, so only 100, they move 84% of that's what you say in 10 years because you won't in term in a swan. What now, na a do, na spread it, and we won't 62% are diagnosed at localized stage with 5 year survival of 99%. But survival rate in Black women a lower, 9% lower compared to a abroad, and it's because of an medical kind say racial bias. Some insurance in the risk survival need lower compared to abroad. Makasa be but breast cancer is sanity.
Yeah, well, that questions and me and Gasanam will be brave and by young head Salima Puku Adebaye. Also, please, if a breastfeeding mother at 6 months feels a lump in her breast almost for 2 weeks now, but the baby is still breastfeeding, I know besides, is the lump a sign of breast cancer, or is there breast milk accumulated there? Biana say Biana,
How long can say the question now? Yeah, but a very good question, Obisa. No. Salima Poku, our question is very brilliant.
I also hear from Fayase, Ghana, Fayase.
Oh, Fayase for my being. Yeah, most likely in the all kinds, or it's a breast accumulation there. Sometimes in ducts ni be one my own. Unse like I say a breast milk a develop in the duct tubes no. Duct tubes no. Now I can me yes idea, but maybe next me present this idea me say the way would the figure is a grape. So offer grape, offer a bunch of grape parts. The way a berries not like a tradition and then a duct tubes no. And a berries and then a so a stem be so. And then ducts, terminal ducts, it in a sonifem, breast milk sonifem, na a cock, lactiferous duct, na ability to a nipple. And or baby on ma, na a baby in an air channel. Some of the lobules and group of ducts need one ma, they are not getting emptied. It's not a formal lump until filias are lump be one. What you can do is say massage it. O massage bois a fence breast milk a flow. O massage was a better can feel lump.
Yeah, me question and I'm one breast implants. We're gonna can say so breast taker. More test is hard to detect.
Yeah.
Now my breast implants. I mean, first of all, does that contribute? Does that is that a risk factor? And as a risk factor, and so does it but does it limit the chances of detecting?
It can interfere with the detection.
Okay.
There, and with a very good question, I was will be saying, yeah, and as a film kakra say, oba, akoshe or say person a new for your faint, or akoshe implants, na cancer, abam. Yes, you could 2 implants, and you're trying to do from the outside to watch. You won't be, it can mask it. But, so implants crana or implants crana still no the screen idea also cost a mammography also cost because mammography the major strength in it is a comparison and they compare previous ones and then they may to me the PK or implant be crana and so previous mammogram images into compare with and changes be by it may pick but obstructive obviously and natural and it doesn't help.
Yo, Doctor, I'm running to that questions in the but who's the time Is a passport for no ballroom? My ballroom, I just say, I'm a bit on the console. And Ibrahim, I just say, Fry Ibrahim. Ibrahim, yeah, you're about to tone there. You have more time to crabby, Nanamboa also, but I'm more 2 minutes into Mr. Wan. The overcoming on a compressor, into one sentence in a fabric. The told Yabado was a baby, number one next week, of course, the best out was so not the own so. As I diabra. And the according to talk a crab by a buy and one just say transition. The doctor to the mechanic. A salute to time that I discussion with baby.
My main cancer next week, maybe I answer a bear presentation be an about time for breast cancer questions.
Yes, questions in the Bible more than that. Because men will be baby pa just
training in a amount for be sending on Montre.
Yes, the baby in a balance and son. Yet was the young Godian Cratformana, young transition to Mohammed because another Mohammed,
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid health insurance program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, what's it for? Some more crab bill. More corner, and I hear more. Oh, arrow. I'm so what me too. The arrow, na bram kakana. And then the passports, Omujina, Gosinimu, Wawoni Pano, but was all more time. To Mr. 2 minutes. 2 minutes. The Sraw, last week, here, a defense, Dr. Furin, more time. At the men on another 2 minutes. The Akanyan, focus freezer. Yambo, that's Kinadia.
Kwame, ohese na misibo mitrinko na. I say akwabia oye hustler na ne call fried rice na. Onya 10 cents akoto fried rice le ewie. Odiwe o say when ka me koto mo one cup anka me mia me biaka. Ama. Ejebo ene are ho pa say menya time because enen se no emodu pa na are ho eni die and it's very sad and so you be find I say akwasini mo juma odibedi enya sam keto a na kwa ode breast na some doctor say you function next week because squad go macho mu bisa nsem me fama mo but ode you function next week
you best spend time kakra na me questions na doso most na na me ma de mo nom no phone no
bebre kwa yeah doso pa te men kan yes e didi ko me time mu kwa me Ghana for ninja Kwame COVID vaccine no ya hwe ni musa nyame adom COVID vaccine di biaba na ebi bae no afide nipa do ebi ko fine ama Kumasi cry there ya shall last week Friday you so aye was throughout I think Wednesday nyame adom na ebe ende en cry for so be show mo dia say nyame bo ochena e na akakrafo nso be share omo vaccination asena dia e tell say
and granny akra no difference ne say.
Sorry, but I cry. And and cry. I cry, of course. By the time not about Minister, Mr. Bato fire pressure. It's yeah, sure. And anymore. I mean, unim said COVID vaccine now. Me pa Dr. Fori Chow said Dr. Fori pan with him. Now, Sikanaman for a DJ. I said, we Macassa, Dr. Fori. Minimum say, I consider Modi and catcher now, obeying Mujuma. Mr. Momunya be found out vaccine is can use your bini. Because sikana amount for GDI nedidi Kamea said now no Ghana penufo enyom ba kwa moto ne ze ye pia ko bontin disi edisi ka ba fie and one esa anyom na omoto because now sikana omde come shake no shake say afido this sikana man but still people are still calling on the health minister say on resign and then they are even asking say what's the evidence say indeed sikano odiaba na so odiaba no or kama Ghana for any age keke and assessing. Why it's been on and off. Adia COVID vaccine no, but me afraid you know, me din sama hishema ma emu ayema. It you know they say me who they me here film the ama for and then the ama san fan go share fridge na next week me dia ba. Why
Yes, for the academy na kushim. Number next week na dia ba. Because me time no already no we have time no 12:01 our Chicago, which means there's a passport I started that. The Mohammed, yeah, but there was a baby. Open try never sponsor no so. They say health in the day. They say no, your time so. And that's therefore Hannah never be a come here to the no abba. Number same time next week, you know, you must have a bank. There they will be also abramo. Dr. Atona Moten cancer or they brain or church breast cancer. Of course, Dr. Forrest Bomachidom. Then Mohammed is so free Ghana. The man be about 2 minutes also about church and Adjunct. I want the comments by Dr. Dan Somo. Just say, let me encourage you. I need a pact. There's someone more fancy. Number next week, you know, the band and you go through near yes or 3 years out. You're doing Abramo. And from the series of alcohol radio, most of Fukamanu. I intend to Macramo.